and welcome. I am Carmen. I own Integrative Myofunctional Therapy. I am solely an online therapist and educator, and I like to call myself your myofunctional educator extraordinaire. So I'm very happy that you're watching. Today, I'm going to talk about Myofunctional Therapy 101. So what the heck is it? This word gets tossed around a lot, and I get so many emails of people saying, I've never heard of this, and what is it? So my explanation of what myofunctional therapy is it is therapy that helps rehabilitate the oral structures and make sure that you are functioning at an optimal level. When somebody has myofunctional impairment, which at this point you probably have no idea what that is, you are functioning less than optimal. And it's my job to help you understand and get to that point where you want to be. You probably have no idea what is wrong, so it's my job to help you understand that. And some of these areas of myofunctional impairment seem like that's just your normal. That's how you've been. That doesn't mean that we can't change it. What is normal could be just your normal, and I'm going to help educate you so that you understand that, hey, that is not normal. Swallowing wrong and having digestive issues is not normal. So stay with me here, because I'm going to give you a little bit of the roadmap of Myofunctional Therapy 101. So we talked about what it is. Now let's talk about when. So what I want you to understand is do not rush this process. There is a lot of discussion right now, and a lot of people get so very excited to just jump in and solve all of their problems, but they don't go about it the right way. So what I want you to first pay attention to is take some time. I caution you that it's very important to find the right provider, ask the right questions, find a fantastic myofunctional therapist to work with, and start that adequate pre-procedure therapy. If you don't have the money, save it. Slow and steady wins the race here, and it's okay to take some time to do things properly. You are not sitting in a room that's on fire, so take some time, my friend. It's okay. Now, another question is, where do I find a therapist? So you have a couple options. You can find a local one, which would be great. And then you can also find one who works online that practices teletherapy, and that's what I do. I love this option. Even way back when I used to see clients in person, they hated the fact that they had to drive across town to see me for 30 minutes and then drive back across town. It was crazy. It wasn't efficient. And so that's when I quit even seeing local clients. I don't even see anybody in person anymore because it just wasn't efficient. The other thing I love about practicing teletherapy is I get to bring this important therapy to all corners of the globe. And these people, if I didn't do what I do, these people would never get to have this important therapy. So I feel kind of like their hero sometimes because I'm giving them access to this therapy that they so desperately need. Now let's talk about the why. Why do you have to do myofunctional therapy? First, you don't have to. I certainly recommend it. But this therapy helps rehabilitate the oral structures. So the best example that I can give you is you don't just go get a new knee replacement or a hip replacement and never do anything to make those new procedures function properly. And the same with myofunctional therapy. In a very ideal world, if everything was perfect and all of the practitioners gave all the right advice, this wouldn't happen because doctors would understand the importance of doing pre-procedure therapy. But this is going to help rehabilitate the oral structures. Your tongue, believe it or not, is the only muscle in your body that does not have an origin and an insertion. So like your hamstrings, you don't have to tell them which direction to go. You hope that they're just going to go the right direction, but your tongue, not so much. So if you have a tongue tie and you release that, now you have all of these muscles that don't function properly. Some of them seem like they don't function at all. Many of my clients, when we start working together, their tongue is just flat and flaccid and does not function at all. But of course, we work through that. So that's what myofunctional therapy does, is it helps rehabilitate these oral structures so that they're strong and that they function properly. Okay, the big question, how do you get started? I want you to find yourself a myofunctional educator extraordinaire like myself who can guide you down that path, who can help you, who can sort fact from fiction and be your person. Today in my Facebook Live, I will be talking further about what myofunctional therapy is and also what it isn't. I will talk about the first things that you need to think about and understand, the questions to ask yourself, and then things to consider. So you can catch me live over on Facebook today. I'm at The Tongue Trainer, and I'm going to be there at 11:30 Mountain Standard Time. Also, I don't want you to forget, if you think you have myofunctional impairment, you should check out my free assessment tool that will help you screen yourself for these concerns. Take the time to download this free assessment tool. You can have access to it right at the very end of this post. And then you'll get that. It'll give you some guidance. It'll answer some questions. It'll take you from curious to confident in under 5 minutes. And I'm here if you need me. I will see you in the next Myo Minute. Bye for now.